There's a serious new report out today that says women are dying from overdoses of prescription painkillers at an alarming rate. The CDC says nearly 48,000 women have died from prescription drug overdoses, a five-fold increase in the last decade. Dr. Holly Phillips is with us. Good morning.
Good morning, Nora.
Okay.
Those are astounding numbers.
Big numbers. What drugs are we talking about?
We're talking about prescription painkillers, narcotics, very powerful drugs. Most of us have heard the names of the most popular, like Vicodin, Percocet, methadone, OxyContin. These are drugs that initially were used for very severe pain, burns, end-stage cancer. And now they're more common.
And now you have women coming into doctors' offices and asking for these drugs by name.
Yeah, you know, Nora, I think that's probably one of the most striking changes I've seen in practice over 10 years. These drugs have become completely destigmatized. Women know the drugs, they ask for them by name. You know, 10 years ago, a patient would come in and say, Doc, I've got low back pain. Is there something you can give me? Now, women of all types of women, from soccer moms to the elderly to executives, those women will come in and say, Doc, I've got low back pain. I'm going to need 18 tablets of Percocet, 2 Xanax, and I'm going to need X, Y, and Z. They know the drugs by name and they ask for them.
So why so many overdoses?
Well, really, it has to do with how many drugs are out there. Women are more likely to see their doctors asking in pain, and then they are more likely to get a prescription. Doctors are also prescribing more. I think we've all become desensitized to the drugs. And
so more drugs, more prescriptions, and by numbers, simply more overdoses.
Absolutely. And people have become very comfortable. It's like we've forgotten how serious and deadly these drugs can be.
The CDC report also said that these deaths are up among men, too.
They are. It's just that the proportion of deaths has really skyrocketed in women. We used to see it more in men, and now women are closing that gap, which is really frightening.
All right, Dr. Holly Phillips, good to see you. Thank you so much.
Great to be here.